A so-called scan of the body systems is conducted by means of trigger sensors that are worn on the patient's head. It implies measuring torsion fields emanations, all the cells of the human body, and biologically active points without exception, as well as the level of bacterial activity, parasites, and other infectious agents. During this procedure, virtual models of various organs and sections are displayed on screen. The actual state of the organs, either normal or pathological, is displayed with the help of a special marker system. Even at this stage, it is possible for an operator to identify problem areas for a more detailed further examination. The highlighted areas are thoroughly examined by a specialist. The program has several modes of the results displayed for this purpose. The program utilizes several modes to scan for deviations, some of which allow for the exploring of a specific area of the body down to its cellular structures. A specialist instantly adds deviations revealed, such as pathologies, infectious agents, or other deviations into the final examination report. The report can also include a proposal for treatment, preventative measures, and nutrition, all automatically generated from the database program standards, based on the condition of the body at the time of the scan.